Hi there, Dr. Straz here again. A little bit ago I posted a video regarding post-concussion syndrome and how someone can get a misalignment in the upper part of the neck, because we know that takes a lot of force to cause a concussion and a lot less to actually have an injury to the upper part of the neck. And in that video I mentioned a little bit about how that affects cerebrospinal fluid, the fluid that surrounds the brain and the spinal cord, and how it can affect the flow of that. And this is targeted at someone that might play football, soccer, anything where there are high impact sports where they're using their head a lot, or if you just had any sort of head injury or neck injury in the past and you're having more chronic type conditions or symptoms like migraine headaches, ringing in the ears, dizziness, vertigo, brain fog, memory issues, cognitive things like that, or if it's just something you want to get checked out, if you have a child or anyone in your family that plays any of these contact sports, to make sure that their nervous system and spine is healthy as possible. But how that affects what's called cerebrospinal fluid is, when we look at the brain, most of the cerebrospinal fluid is created more in the center chambers of the brain called our ventricles, and it kind of perfuses out around the brain and the rest of the spinal cord. And it's really important to make sure it has a proper flow, because it delivers nutrients to the brain and the spinal cord and all that neural tissue. But it also is a key factor in draining away or washing away any metabolic waste that builds up within the central nervous system. So if that fluid becomes stagnant, that becomes toxic to the brain and the spinal cord. It can lead to like brain fog, headaches. They're actually starting to look at that with multiple sclerosis, where they're seeing an effect on how that cerebrospinal fluid is having impact on that plaquing on the brain. So if we get a misalignment through here, we can actually see on upright MRIs that the flow of that fluid around the brain will become more stagnant, and it has more of an impact because it's essentially becoming clogged in that area, and that flow is not established the way that's supposed to, removing a lot of those that metabolic waste, and those proteins will build up in the brain. And so what we do is we take a very specific postural assessment, range of motion. We take very precise x-rays to determine how this area is misaligned, and without any twisting, popping, or cracking, we, based on your x-rays, gently bring that bone back into its proper position, with the head and the spine below it opening up this area, allowing that fluid, of that cerebrospinal fluid, to be reestablished. And we start to see those patients respond really, really well over time, as long as they hold that correction. And we go over different ways that you can do that in the office. And we also make sure we take post films after that first correction, so there's really no guesswork. We're making sure we're making that correction, opening up that pathway, and really watching those patients that deal with that or have a misalignment there or have had post-concussion syndrome respond really well. If you want to learn more, go to strazspinalcare.com, or you can call for a complimentary consultation at 314-332-1871. Thanks.